Okay, so this is going to be part two of a video that I did in which I talked about, the first video, in which I talked about if your baby has their umbilical cord wrapped around their neck, which is called nuchal cord. If this happens during pregnancy, does that automatically mean that they are going to suffer a traumatic brain injury like HIE? And in that video, I went into depth as to these issues from the pregnancy standpoint. And then I talked about also the second part of that video, I talked about during labor and delivery. And I went into detail in regards to nuchal cord during those two situations. If you are watching part two first, I would say pause this one and go and watch the first one first, so you'll have an idea as these to these issues globally. Now, for this video, what I want to talk about is, well, then, if the baby, let's say the baby has suffered a traumatic brain injury, how then do we know if that injury happened, if that nuchal cord caused a brain injury? How do we know if that happened during pregnancy, or did it happen during labor and delivery? And that was because during labor and delivery was because of something that the doctors or the nurses did or failed to do. In other words, birth trauma or medical malpractice caused the brain injury. So to really be able to understand this video is really a continuation of a video that I did a few days ago, in which I talked about timing a birth injury, timing a brain injury specifically. And in that video, I discussed the importance of scans and imaging. And I talked about the role of a medical expert called a pediatric neuroradiologist and how they are able to read scans and be able to interpret certain things. And I'm going to add that into this video to help you understand how we go about having a good idea as to when this injury might have happened. So if you have a baby that has a nuchal cord situation, and you are unfortunately in one of these categories in which the umbilical cord does become compressed during pregnancy, and the baby does not get enough oxygen, either blood and oxygen is cut off, or it's reduced in such a way that it causes the baby to suffer a brain injury. What we can normally see is that when that baby is born, and let's say the baby is suffering seizures and the baby is having some more other challenges, and the doctors and the nurses, they begin to do a workup on the child, and they do scans and they do imaging. They do, let's say, for example, a 24-hour ultrasound. They immediately do an ultrasound and they try to get an idea as to what's going on. If they look at that early ultrasound, that first ultrasound, that day one ultrasound, and that ultrasound is showing evidence of injury to the brain, then a strong argument is going to be made that that injury, it was something that happened during pregnancy. And let's say the baby was dealing with a nuchal cord, they may say, well, then the argument will be then that that nuchal cord happened during pregnancy. There was either a cutoff of blood and oxygen to the baby, or there was a reduction in blood and oxygen. In other words, cord compression happened, and it happened in such a way that it actually caused the baby to suffer a brain injury. That's the first example. The second example, what we can see is if a baby is born with nuchal cord, and when the baby is born, they're having certain challenges. They may have seizures. They may have certain things going on, and this makes the doctors and the nurses do certain things. They do head scans. They do all the imaging. They take a look at things. And that day one ultrasound, for example, let's say that day one ultrasound, a 24-hour ultrasound, when they look at that ultrasound, what they can see, if that injury happened during labor and delivery, or a strong argument can be made, if that ultrasound is normal, if it's showing normal right out of the, right out, if it's showing normal, and then they do a subsequent scan, and that subsequent scan is now beginning to show a brain injury, then in that situation, a strong argument can be made that no, the injury did not happen, or that there was not a nuchal cord which caused an injury earlier in pregnancy. That injury probably happened more than likely during labor and delivery because of the way the injury is being revealed on the scans. If it was something that happened during the day 1 scan, then there's a strong argument that that injury happened earlier. If the injury begins to manifest itself later down the line, then a strong argument is going to be made that no, it didn't happen during pregnancy. This was something that happened during labor and delivery. And then now we've got to look to see what was going on with the electronic fetal heart monitor. What did the strips show? What was happening during labor and delivery? And was it anything in there that the doctors or the nurses that they did or failed to do, which is what caused the injury or the harm? And in this case, it would be a traumatic brain injury to the baby. So I just wanted to put all of this together with you to help you understand this nuchal cord issue and being able to time when did the injury happen? Did it happen during pregnancy? Or was this something that happened during labor and delivery? And then if it did happen during labor and delivery, are the medical professionals, are they the cause of your baby suffering that traumatic brain injury? If you have more questions, maybe you're here today watching this video because your baby has suffered a traumatic brain injury like HIE and you have questions, you want us to do a birth injury investigation to help you understand what caused this, what was going on. If you have that happening, what I invite you to do is go ahead and pick up the phone and call us. There's a telephone number down on the screen. I invite you to go ahead and call us. And you know, when you call, be sure to let my secretary, let them know that you want to pick a date and a time to get on our calendar so we can know when to call you back. So that's important. Pick a date and a time. And one more thing before I get out of here. Also too, the call, initially to talk with us, it costs absolutely nothing to do that. You got to understand though, that if you call us, because this video is on the internet, it's on YouTube, it's on other social media platforms, it's on our websites, it's on a lot of places. I can't control who's going to call. If you call and you are not in Maryland, you're in the United States, but you're not in Maryland, understand that we have to use what we call co-counsel or local counsel if you are not in Maryland. That's something that we can help work with you on, but I just want to make sure that you understand that co-counsel or that local counsel aspect of things if you are not in Maryland. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law in the state of Maryland at Boston Law Group, LLC. We'll talk with you next time. Take care. Enjoy the rest of your day.